Hello, I'm Dr. Nicholas Tedesco D.O, Co-Associate Program Director of Good Samaritan Regional Medical Center's Orthopedic Surgery Residency Program in Corvallis, Oregon. Today I'll be lecturing on musculoskeletal oncology, histology basics as part of our ongoing online lecture series to supplement the in-classroom case-based learning presentations. I do have my normal disclosures to make, and they are up to date and available publicly at the AAOS website. In addition to those disclosures, I have a large disclosure to make regarding this presentation. The idea for this presentation came from many resident requests to find a way to show them exactly how I work through histology to reach a differential or definitive diagnosis. This is my best attempt at these algorithms that I've developed in my head over the years to ping-pong around and come up with a reasonable guess at the histopathology. This is in no way, shape, or form definitive, absolute, or anything that you would ever be responsible for knowing on a standardized test. Rather, this is a tool to help you with the histopathology when you don't even know where to begin. You'll notice some pathologies fall into multiple algorithms, and it assumes the quote-unquote classic pathologic appearance of the different musculoskeletal tumors. Obviously, real life is much more complex than this, so you could use the algorithm properly and still come up with the wrong diagnosis. Again, this is not meant to be definitive, but instead another tool in the box to help you out on a test of this knowledge. Additionally, there's no clinical or radiographic cases given that would normally very much help nail the diagnosis. Instead, this is just a pure abstract look at the histology. The best way to use this presentation will be to copy the algorithms in your own hands and your own words, and then use those to help guide you as you go through question banks or review pathology so you can get used to using them and see where you might be going wrong in what you're looking at. Finally, the last caveat is that this presentation does not go over specific definitions or findings. It assumes you already know and can identify things like spindle cells, epithelioid morphology, mitotic figures, eosinophilic versus basophilic, small round blue cells, and many other things. So if you're still unsure of any of these or you get confused at any point during this presentation or use of these algorithms, you will need to reference my other orthopedic oncology lectures where we cover specific pathologies to learn these particular terms and get used to recognizing them. So without further ado, we will get to the algorithms and then several case examples for how to work through them to arrive at a diagnosis. So first we start with our main algorithm. This is going to help get you to a sub-algorithm. So this isn't going to give you the diagnosis with the exception that you might be able to diagnose eosinophilic granuloma right off the bat, but really this is going to help get you to a different algorithm that will finally get you to the definitive diagnosis. So it assumes that we're always starting with a hematoxylin and eosin stained photomicrograph, which usually you are on a test. And the first thing you want to look at is just overall, what is the color? Is there tons of blank white space? Is there tons of blue and purple? Is there tons of pink and red? Or is there a good mixture of both blue and red? Then you'll break that down further, keep ping-ponging around, and eventually end up with another algorithm. I'm not going to go over every box within this algorithm because I believe that will insult your intelligence and won't be within the scope of this presentation, which is really to show you how to use these algorithms. So let's start with the blank space algorithm. The first thing you want to look at is why is there blank space? So is there a cellular lining with an adjacent empty space? Are there lots of pink protein filaments with very few cells, or are there just tons of cells along with that blank space? Then you'll break that down further depending on where you're now going with the algorithm. Eventually, there's a few things that you may absolutely need to know that won't be present on the photomicrograph. Things like, are we in bone or soft tissue? Because there are bone and soft tissue pathologies that histologically may look identical. And so you need to know where you are. And so the clinical description or the x-rays and MRIs that they may give you in the stem of a question are what's going to help you get these diagnoses. So you'll see even on this algorithm, we can't quite get to all of these diagnoses on histopathology alone. You'll also see a couple of things here that ultimately you can't really see on the H&E stain, things like a brachyury immunohistochemical stain. So there are some of these algorithms where you will eventually get to an immunohistochemical stain that helps differentiate each particular pathology. That will need to be given to you in the stem of a question, or they'll need to show you a separate photomicrograph of an IHC stain showing T brachyury positivity or some other IHC stain for some of these different ones that you'll see. When we get to the cartilage algorithm, obviously you need to be able to recognize cartilage matrix. That's not something that I can teach you necessarily. It's something that you just have to look at over and over and again to where you recognize right off the bat this is cartilage. It'll help if you reference my cartilage-based tumor presentation also on YouTube. First thing you want to look at once you have identified cartilage matrix is, are there lacunae present or not? Additionally, you'll need to be able to recognize the difference between hyaline matrix and mixoid matrix. So you're going to have to go over that. We will cover that a little bit on some of these cases, but you need to be able to differentiate between the two of those to figure out kind of where you go next, especially when there's no lacunae. Again, you'll see a few things on this slide that need immunohistochemical staining or need to know where is the location of this particular tumor. Are you inside a bone, in soft tissue, or stuck to a bone surface? The next algorithm is the small round blue cell algorithm. Again, you have to be able to look at a slide and recognize these are small round blue cells. You can reference my bone tumor and small round blue cell tumor lecture also on YouTube to help look at these and get used to this a little bit more. You also need to be able to recognize pseudo-rosettes and what those look like to be able to figure out the very next step in this algorithm, which is whether or not those are present. You also need to recognize a polymorphonucleocyte under a photomicrograph and be able to tell the difference between that and a standard mononuclear cell. Here, you will need to know a lot of immunohistochemical staining as well as genetic analysis to help get these different diagnoses. When you get to the protein algorithm, what we talk about here is identifying protein under an H&E stain. And this is one where it's mostly protein that you're looking at with very few cells that'll be there, usually just the fibroblasts that are making the protein, but by and large, under the photomicrograph, it's lots of protein. You also need to be recognizing whether it's sheets of protein or filaments of protein. And so here's where you'll have to ping pong around again. You will need some immunohistochemical staining ultimately to get these diagnoses, but you need to be able to recognize protein under a microscope. The next is epithelioid morphology. So you have to be able to recognize the difference between a spindle cell or a mesenchymal cell and an epithelioid cell. So epithelioid is just a description of the morphology, usually a much more round cell and a cell that you can outline as opposed to a spindle cell that is usually an elongated cell, and it's very difficult to tell where the cytoplasm for one cell stops and the next cell begins. So it's sort of this blending milieu of H&E staining where you have lots of nuclei everywhere, but the cells aren't obvious. So you need to be able to recognize that and look at something and say, this is an epithelioid morphology or a spindle cell morphology to be able to start with this particular algorithm. The next thing you want to look at is there a single cell population, meaning do all the cells look roughly similar, or are there multiple cell populations, meaning you have clusters or sheets of different appearing cells. So in one cluster, all the cells will look similar, but in another cluster, they will look very different than that cluster, but all similar within that cluster. So you need to be able to recognize those sorts of things as well. The next algorithm here is cells in a proteinaceous milieu or other mesenchymal tumors, and that's because most mesenchymal tumors will have a lot of protein in them, or an eosinophilic cytoplasm that's difficult to tell whether or not it's protein or just cytoplasm that all blends together. But this is where you have a lot of cells mixed with this proteinaceous milieu as opposed to the previous protein algorithm that really is almost all protein with almost no cells. So you do need to be clear on what you're looking at in terms of which one of these algorithms you're going to use. Again, we're going to show some case examples that hopefully will help you figure that out. Again, you will need some genetic analysis and immunohistochemical staining for this, but a lot of these you will be able to get based on histology alone. So now let's move on to those cases and basically how we're going to work through these algorithms to figure out a diagnosis. So the first case here is an H&E stain, and when you first look at it, you're like, I don't even know where to begin. There's a lot of cells. I'm going to assume this is malignant, but let's back way off on that and just start with that main algorithm. So here is the main algorithm. We have an H&E stain we need to know next. Is there tons of purple and blue, tons of pink and red? Is there a mixture of both, or is there a lot of blank space on this? Well, there's a lot of blank space on this, which skips immediately to the next algorithm. So again, let's go back to that histology. There's lots of white all over this. Normally, if you're looking at histology on a test, it's going to be all cells and all protein or all cytoplasm or whatever the case may be, but there will be very, very little or no white at all. So when you see this much white, you need to recognize this as a tons of blank space type of tumor, so we've got to get to that algorithm. So the first thing we need to find out is there a cellular lining with adjacent empty space? Are there lots of protein filaments with very few cells? Or are there tons of cells present? Well, at first, when you look at this, you might say, well, there are tons of cells present, so that's what we're going to go with. But I've highlighted here where you have a lining. You can see those cells get thinner and denser where there's a very clear lining directly adjacent to this blank space. So you have to be very careful which part of this algorithm you start to choose. There is a clear lining to this space, and that's what all these arrows are demonstrating. So you have to be able to recognize that. You have to look at the blank space and see, is there a lining directly adjacent to it? And the answer here is yes. So even though there are a lot of cells here, there's more to it than that, and this is a lined cavity of some sort. So now that we know and we have identified that there's a cellular lining with adjacent empty space, we need to know, are there red blood cells in that space or not? So now we're pointing to all of this dense pink. Those are all red blood cells. So there is a ton of red blood cells within this blank space directly adjacent to that cellular lining. So now we have to go to our next question. So there are red blood cells in the space. Now, do we have pleomorphism or no pleomorphism within here? So again, when you step back here, at first you want to say, oh, this is ugly, this is hypercellular, this is going to be a malignancy. But when you really slow down and take a look at it, you have areas of lots of protein right in the dead center. In the upper right-hand corner, you can see relative hypocellularity. And when you really look closely and just start looking at all of these cells, they all look remarkably similar. There's a couple of different populations of cells. There's probably a few lymphocytes in here if you're good enough to recognize that. But when you really look at the whole cellular milieu in between those lining, they all look relatively the same, like they're a very clear single cell population. So we're at the no pleomorphism portion of this. So here's one where you can't see if we're in bone or soft tissue under the microscope, so we need to know. So let's assume they gave you an x-ray and the stem of the question mentioned pain around a joint or something like that, and the x-ray did show an expansile lesion in the bone. So we are in bone. So now that we know that this came from a bone, we have a lined cavity with blank space with lots of red blood cells, no pleomorphism. This is an aneurysmal bone cyst. And when we look again, we have lots of giant cells, the quote-unquote pigs at the trough that they talk about where they line these spaces, but this is an aneurysmal bone cyst. So when you first looked at this, I'm sure that was very far away from the differential diagnosis that was in your head. So again, you have to slow down, start with the algorithm, but there's a couple of key points in the algorithm where you could go very wrong. So you have to be careful in what you're looking at, and you have to be able to recognize that. If you can't, or if you're having trouble, or you keep getting the same errors and problems as you're going through questions, then reach out to me and let's go over it, and I'll be able to tell you maybe what you're not seeing or where we're going wrong here. All right, case number 2. So here is a very hypocellular lesion with just a couple of cells and lots of purple in the background. So we have a blue/purple thing. And again, comparison to the previous one, there's almost no white space on here. There's a little bit, and especially inside the cells, but really overall, the previous one is a good demonstration of what a lot of blank space looks like under a photomicrograph. So let's go to our main algorithm, and we have our H&E stain. So do we have tons of blank space here? Nope, we just talked about that. Is there tons of blue and purple? There sure is. Is there tons of pink and red? Nope, almost none. And is there a mixture of both? No, it's predominantly blue and purple. So now we've got to get to that. So once we have decided on that, we've got to look at our thing again and say, well, what are we looking at here? Is this calcific debris, which is incredibly dense, dark purple? Do we see tons of nuclei on here and that's what's purple, or is this cartilage matrix? So let's look back at it. Well, we see a couple of nuclei, those are dark purple, but it's not tons and tons of nuclei that make up all the purple coloration on this particular image. Do we see dense dark purple in a haphazard fashion that would suggest calcium debris? Nope, absolutely not. So this is definitely lacunae and cartilage matrix. So again, you need to be able to recognize what cartilage matrix looks like right off the bat. So we're into the cartilage matrix, so that's going to jump us right to the next algorithm. So the first thing we need to ask when we look at this is, are there lacunae present? So if there are, that's going to shunt us down one large algorithm, and if there's not, that's a much smaller algorithm. So let's go back to this. Well, there's lacunae. So we're pointing to that on all of these. So you do have cells within here, but there's a very clear change in the matrix surrounding those cells and walling them off, creating a lacunae, and that's what we're pointing to here. So you need to be able to recognize lacunae versus random cells within this proteinaceous milieu. So there are lacunae present. So the next thing we want to say is, are there multiple cell populations? Or if there's a singular cell population, is there a zonal phenomenon, or is this amorphous? So we only have one cell population. All of these cells look roughly similar, a similar nuclei appearance. There's not a cluster of one type of cells and another cluster of one type of cells. So we're into the single cell population portion of that algorithm. So the next question, as we just mentioned, is there a zonal phenomenon, or is this more amorphous? The zonal phenomenon is just like what you normally would see in a growth plate or in hyaline cartilage, where you have zones, where you have a proliferative zone, a hypertrophic zone, a transition zone, a reserve zone, all of those things. So we don't have a clear delineation of zones on here. This is much more of a haphazard or amorphous cellular appearance. So once we're in that, the next thing we need to know is there cohabitation, or two cells to one lacunae? When we look here, that's what we're looking for. So you have to look at every one of these lacunae, and I don't really see two cells and one lacunae anywhere on here, or certainly not commonly. Maybe you could argue that one in the very upper part that gets cut off, maybe there's two nuclei in there. Hard to say. That could be a cell that's dividing and about to create a new lacunae, but it gets cut off. But either way, there's not lots of cohabitation on here. So predominantly, this is a singular cell to a singular lacunae. So we're going to go with no cohabitation. Again, the next question we have to ask here can't be found under this photomicrograph. We need to know more in the stem of the question, or based on radiographic appearance, where this is. So we're going to say this came from a bone and inside the bone. So let's say an x-ray was given, or they just told you this is within a humerus or something like that. So let's go back to that. We're inside a bone. This is an enchondroma. It's the only thing it could be. Had we been stuck to the bone surface or had a shark bite out of the cortex of the bone, we've got a periosteochondroma. If we were in the soft tissue, this would be a chondroma. Histologically, they all look identical, so you need to know where this is located to be able to tell which one of these diagnoses it is. So again, this is an enchondroma, pretty easy to get to as long as you can recognize those findings. But you can see that's a very complex algorithm, but we were able to figure out the diagnosis pretty easily. All right, here's our next one. And you can see here I labeled this case 3A, and that's because this is a diagnosis that falls into multiple algorithms. So don't worry, you're not wrong if we picked a different algorithm on this one. You're going to see in case 3B, we're going to work through this using the other algorithm that this falls into. So again, the first thing we look at is the H&E stain. What do we have here? Do we have tons of blank space, tons of purple and blue, tons of pink and red, or a mixture of both? So let's go back to that image. And what I would say is, by and large, this is a small round blue cell tumor. There's tons of purple and it's almost all nuclei. So me personally, I would shunt this down the small round blue cell tumor pathway. So that's what we're going to start with, but we're going to go down a different pathway once we go through case 3B. So we see tons of purple and blue, so now we've got to go back to it. And again, the same thing that we asked our previous case, is this cartilage matrix, is this calcific debris, or are these nuclei that are accounting for the purple and blue? Pretty obvious here, it's nuclei that are accounting for the purple and blue that we see. There's not obvious cartilage matrix. There's not obvious calcium debris. So let's go down the nuclei and small round blue cell tumor algorithm. So once we start with that, we need to ask, are there pseudo-rosettes here, no pseudo-rosettes, or are we seeing lots of polymorphonucleocytes that might indicate inflammation or a reactive process? So when we look here, we don't really have any rosettes or pseudo-rosettes. We don't really have any polymorphonucleocytes. All of these are mononuclear with no indentation. So now we're going to go down the no pseudo-rosettes or PMNs pathway. So the next thing we have to say is there no cytoplasm or limited cytoplasm, or is there a lot of eosinophilic cytoplasm? Well, what we're pointing to here is the cytoplasm. So this is sort of tough to see because you have some pink in here. It's really hard to tell what's going on, but there is some eosinophilic cytoplasm within these cells. So it's really tough to see, and a lot of them almost look like clear cells, but much of that is artifact as a result of the drying process when you're plating and staining these. And that's hard to know and hard to recognize, but you have to look at these areas that I'm pointing to where we do have some eosinophilic cytoplasm. So it's easy to miss that, easy to go wrong here, but it's there. So the next thing we need to know is, do we have any immunohistochemical staining that they're giving us? If not, and there's no chicken wire calcification or cobblestoning, then this is rhabdomyosarcoma, and there's lots of immunohistochemical staining and genetic analysis that they could give you that could lead you to that as well, but just morphologically, that could be what this is. But instead, let's go back and look at this. So there's no IHC staining given, but now what we're pointing to is this pink border around all of these cells. So this is the cobblestoning phenomenon or chicken wire calcification. So this is one now where when we go back to that algorithm, we do have cobblestoning. This is a chondroblastoma. So again, when you first looked at this, I'm sure no one picked this out as a chondroblastoma. But once you really know what you're looking at under the microscope and you can pick out these boxes correctly on the algorithm, you get to that answer, and that's the right answer. But again, let's go through a different algorithm. So we have a chondroblastoma here. We went down the small round blue cell tumor algorithm, but let's pick a different one. So now when you look at this, you might say, well, there's a ton of pink and blue, and you're not wrong. So let's go down that algorithm. So again, we're asking those questions on this main algorithm. We have a mixture of both. We have pink and blue. So this could fall in that. So now let's go through that. So again, we're looking at this slide. We need to know what we're trying to find out. The next thing we ask under that algorithm is there pink inside and outside the cells, or is there pink only outside the cells? Or what cells? Not meaning that there's no cells, meaning that you can't tell where the cells start and stop. So there's lots of nuclei, lots of pink, but you can't tell, is that pink actually inside the cell or is it actually outside the cell? Where does one cell stop and start? That's what I mean by what cells. So here, when we look at this again, we've got an epithelioid morphology, and you have pink inside and outside the cells. Just like we showed before, you have a little bit of eosinophilic cytoplasm, but you also have that even more dense pink cobblestoning phenomenon outside the cells. So again, you need to recognize that. You need to look inside those cells and look at that cytoplasm and recognize that. You also need to recognize the pink outside the cell. So now we're going to go down the epithelioid morphology algorithm. So the first thing we need to ask is, are there multiple cell populations or a single cell population? When you look at this, okay, maybe there's a mitotic figure there in the middle towards the right side, but really it's one cell population. All of these nuclei look very similar, similar size, similar shape, similar density. So this is a single cell population. So we're now going to go down that algorithm. The next thing we want to know is this tumor forming glands or pseudoglands? Again, we're not going to go over what glands look like. That's something you need to already be able to recognize. If not, do an internet search or look at some of the sarcomas that form pseudoglands like alveolar soft part sarcoma, biphasic synovial cell sarcoma. So when we look back at this, clearly no gland formation. So we're going to go down that pathway now. So do we have clear cells or no clear cells? Again, this is where it gets confusing. A lot of these cells do look clear, but you have to recognize that's an artifact because only a few cells actually look like that. most cells do have a cytoplasm, and that's what we're pointing to again here. So now we're going to go down that, no clear cells. Once we can look at that, we need to say, are there obvious cell borders or no obvious cell borders? The first thing you're going to want to do is look at that cobblestoning and say, there are obvious cell borders here, but I've pointed to the background cell population of this particular tumor compared to the area that has that cobblestoning phenomenon. So down at the bottom, upper left and upper right here, there's actually no clear delineation from one cell to the next. There's lots of nuclei with lots of eosinophilic material. That's the actual tumor itself. Only a small portion of this tumor usually demonstrates this chicken wire calcification. So even now that we know this is a chondroblastoma, you have to be careful with what you're looking at here. So you have to look at these cell populations that indicate what the background tumor actually looks like. So we're going to go down the no obvious cell borders. Now we're finally at the, is there cobblestoning or no cobblestoning? Is the whole thing no obvious cell borders, or is there at least partial cobblestoning? And here, again, we looked at it before, there's at least partial cobblestoning. So the only thing this is chondroblastoma. So again, we went down a completely different algorithm, but we came to the same diagnosis. It's very challenging to get to that diagnosis. Again, you have to recognize that there's no obvious cell borders to the actual background tumor. You have to recognize that it's a single cell population. So this is a challenge to get this, but this is why you need to work through these over and over again to be able to recognize these small, subtle findings that help you get to the right diagnosis. So case number 4, here we see something that looks very different than anything we've looked at so far. So we're going to go to that main algorithm and ask ourselves that same question. When we looked at that, there was tons of pink and red. So we're going to go right for that. There was almost no purple on that image. So now let's go look at that and answer our next question of, are we looking at protein, are we looking at skeletal muscle, or are we looking at eosinophils that are accounting for the red color? Well, we have lots of filamentous strands of protein, a couple of cells in there, and fibroblasts, but we don't really see striations that would indicate skeletal muscle. We also don't really see a mononuclear cell population with dense eosinophilic cytoplasm that would indicate eosinophils. So we're going to go down the protein algorithm, which shunts us immediately to another algorithm. So now we're into that lots of protein and very few cells algorithm. So the first thing we need to identify is, are there sheets of protein with no obvious filaments, or are there obvious filaments? Well, when we go back, you might think this is a giant sheet, but really it's filaments. You can see the waviness of them. You can almost see the different collagen bundles within here. So this is filamentous protein, not sheet-like protein, like you would normally see in the hyaline cartilage matrix of that enchondroma, if you want to go back in the video to look at what a sheet of protein might look like. So now that we have filaments, we have to say, well, are there some cells or are there almost no cells? Well, you can see that purple scattered throughout there. There are some cells. When I mean almost no cells, I mean, maybe 3 nuclei on this entire thing or none at all. So you do have to be careful with that not having a very clear definition, but there are certainly some cells on here. So we're going to go down that pathway. The next question we're going to ask is there lots of empty space or is there limited empty space? Again, you have to recognize that the empty space that's on here is artifactual. So as we dry these out and we use an alcohol prep as part of the H&E staining, you get separation of those filaments that normally are pretty tightly bound together. So that's artifact. This isn't true empty space that we're thinking about that is part of the actual histology. So you do need to be careful. You do need to recognize that this is not typical empty space as we would think of it, like a giant cavity in an aneurysmal bone cyst or something like that. So we're going to go down the limited empty space here. So once we do that, that shunts us right to a diagnosis. This is a desmoplastic fibroma. There's not a whole lot of other things that look like that. So here we are with a desmoplastic fibroma. Filamentous protein, limited empty space, and hypocellularity, but still cellularity present. Now, I want to contrast that with what I mean by lots of empty space with these particular protein ones. So we're going to go with a haphazard morphology and a myxoma here. So here is what you're comparing. So this is lots of empty space, not limited empty space. So let's go back to our Desmoplastic Fibroma. And again, you can see that there is some empty space, no doubt, but it's artifactual and it's nowhere near as prevalent as what we're talking about with a myxoma if we go back to that one again, just to show you once again. So you do have filamentous proteins here. You do have some cells. It is a single cell population, but there's lots of empty space on this. And that accounts for all of the added fluid that's found within a myxoma that makes it so bright on a T2 or STIR image. Now we'll move on to case number 5. So here's one where we've got a couple of different findings under this microscope. So you can see a lot of this pink milieu and then this hypercellular purple milieu. So let's go to our main algorithm, and what do we have? Do we have tons of blank space? Nope. Do we have tons of blue and purple? Yeah. Do we have tons of pink and red? Yeah. So I would say, hey, we've got a mixture of both here. So the next thing we want to ask is, do we see pink inside and outside the cells, or is there pink only outside the cells, or again, what cells? Meaning, do they all cluster together and run in between the pink where we can't tell where one cell stops and starts? So when we look here, the black arrows are pointing to the pink inside the cells. That's the cytoplasm. The red arrow is pointing to the pink outside the cells. That seems to be a very different type of pink than what's inside the cells. So we do have both here. We have pink inside and outside the cells. So we have epithelioid cells. We have clear cells here that we can tell the difference from things that are happening outside the cell. So now we're going to go down that epithelioid morphology again, just like we did with the chondroblastoma. So again, we're going to ask, are there multiple cell populations here, or do we have a single cell population? So when we look at this, we have a large, dense purple cell population running in between this pink milieu on the outside. But within that pink milieu, there's a spindle cell component there that's clearly different and appears different than this other denser epithelioid cell that's running in between there. So we do have more than one cell population here, which is why we have different findings on different parts of this photomicrograph. So we're going down the multiple cell population. So the next thing we need to know is there gland formation or is there no gland formation? Well, when we look at here, again, you need to know what a gland looks like, but there's no obvious glandular formation on this microscope slide. So we have an epithelioid morphology to the predominant part of this image. We have multiple cell populations with this pink stuff running through it. We don't have glandular formation. So what do we have? We have an adamantinoma. So when we look at that, we've got an adamantinoma. Again, usually they're going to give this with an image of a cortical-based lesion in the tibia. So a lot of times you can get to this diagnosis pretty easily and quickly without even knowing the histology. So this is just looking at the histology alone with no other information, but that's how you're going to get to this diagnosis just using my algorithm. So now we'll move on to the next slide. So here we have a new appearance of something going on. We have lots of pink and purple, so let's go to our main algorithm. So again, we have a mixture of both pink and purple. So let's look back at it again, and we need to say, is that pink inside or outside the cells, or only outside the cells, or what cells? So when you look here, there are cells. Some of them may run together where it's not clear where they stop and start, but a lot of them you can identify. But the vast majority and the pink that we're looking at is outside the cells. So we're going to go down the cells with protein or just mesenchymal cells algorithm. So the first thing we're going to need to know, unfortunately, here is something that has nothing to do with the histology. We need to know where this came from. Is this bone and soft tissue? Is this one or the other? And we need to be able to know that. So I'm going to have to tell you that this specimen came from a bone. So when we look at that and we know that that came from a bone, we're in the mesenchymal cell algorithm, we need to go back to the bone. And now we have lots of questions to answer. Is there a storiform and low-grade fibrous tissue here? Is there host trabeculae with low-grade fibrous tissue? Is there lace-like or ribbon osteoid? Is there islands of osteoid, or are there sheets of osteoid? So there's 5 different questions we have to ask ourselves to get to the next thing. So let's go take a look at that. Well, we don't have fibrous tissue in a storiform pattern, so we can rule that one out right off the bat. We don't have obvious host trabecular bone with fibrous tissue in between the trabeculae, so we can throw that one out. So now we're into the osteoid production. So here's where it becomes difficult, where there's no obvious definition of where do we draw the line between lace-like and ribbon-like and sheet-like. So again, we talked about earlier what sheet-like protein might look like, which is the background of that hyaline cartilage, where it's just wall-to-wall protein and there's no obvious filaments and the cells are just kind of stuck in there. And that's not what we have here. So we're either in the islands or lace-like osteoid. When you see it percolating in between lots of cells and lots of it, and it's very thin in appearance, we're talking about lace-like osteoid here. This is not islands like you would normally see in fibrous dysplasia, which are much larger portions than this, and it doesn't infiltrate through the cells such as this, and the cells just kind of line up around it. So now that we've decided on that, we have lace-like or ribbon osteoid, we need to look again and see, is there cartilage also present along with this stuff or not? So usually what you'll see is something like this with a large cluster of obvious cartilage formation and maybe even lacunae in one corner of this micrograph, but we don't see that anywhere. So all we have is pure lace-like osteoid. So we have a conventional osteogenic sarcoma. Had we seen the cartilage component of this, it could be a chondrogenic osteosarcoma, but more often than not on the test, they're not going to get that nitty-gritty with it, and instead it's going to be a periosteal osteosarcoma, but you're going to have to correlate that with your x-rays. That's usually going to be a surface-based lesion, not an intramedullary lesion like a chondroblastic osteosarcoma would be. So now we'll move on to case 7 that's going to use the same algorithm, but a very different diagnosis. So again, we see lots of pink and purple here, so we're going to shunt ourselves down that algorithm. So again, is the pink outside the cells? Is it inside the cells? Is it both? Or what cells? Here's where I would say, what cells? Is that pink inside or outside the cells? I can't tell. Yeah, there's this one stripe of pink down at the bottom, but that could just be a fibrous septae or something like that. It's not clearly part of the rest of what this tumor looks like. So we have this pink that it's hard to tell what's going on here. Everything runs together and looks stuck together. So we're going to go down the what cells population, which again is going to be the cells with protein or just simply mesenchymal cells. So we're going to start with that same question. Are we in bone? Are we in soft tissue? Are we in bone and soft tissue? And we don't know. So what we're going to say is this came from a soft tissue mass. Okay, so now we know that. It's impossible to tell that based on the histology alone. So you have to be given that information or given an MRI or something that showed that. But now that we know that this is a soft tissue mass, we're going to go down a different algorithm. So the next thing we ask is there osteoid production? Are there fat cells, or is this spindle cells? So when we look here, we just looked at what osteoid production looks like, and we don't really see that anywhere on here. There's not a whole lot of lace-like, ribbon-like, or even host trabecular bone or anything like that. So we don't see osteoid here. The next thing is, are there fat cells? And what I mean by that is lots of fat cells peppered throughout here. And the answer is no, probably not. Maybe that's one way down at the bottom there in the middle. Hard to say, but that could just be a blood vessel as well. And that's most likely what it is because there's a couple of nuclei surrounding that. So it could be confusing, but we're looking for lots of fat being peppered throughout this, and we just don't see that. So what we have is lots of spindle cells running throughout here. So that's what we see. That's where we're going to go with this. So the next thing is do we have a storiform pattern, or are these cells all arranged in relatively parallel fascicles? You need to be able to recognize a storiform pattern, which has been described as a helicopter landing in a wheat field, which I think is an excellent descriptor. And that's exactly what we have here. We have cells going every which way. They're all over the place. It almost looks like they're swirling and whirling. So you do need to be able to recognize that, but this is a storiform pattern. So that's where we're going to go with this. So here's where we do need to now figure out what exactly do we have here. We're going to need some genetic analysis, maybe some immunohistochemistry or something like that. So do they give you a whole bunch of negative staining patterns? Do they give you negative genetics, or do they give you something positive? So we're going to say in the stem of the question, they say FISH analysis shows translocation 1722. Just with that alone, you don't even need the histology because obviously that's going to be pathognomonic for this tumor, but this is a dermatofibrosarcoma protuberans. This can also histologically look morphologically almost identical to a non-ossifying fibroma. So this can be very confused with a benign entity because there's not a whole lot of pleomorphism or mitotic figures. So you do need to know that this is in the soft tissue. It's very different. And you need to know that it has that translocation that tells you, oh, this is a monoclonal proliferation of a cellular aberration, and this is a malignancy. So we've got a dermatofibrosarcoma protuberans. There you go. That's what it looks like. So that's our last case. Again, this was just a general overview and a couple of good examples, hopefully, of how to work through the algorithm. So start practicing with them. Let me know if you're having any questions or problems, or if you're finding any glaring mistakes in my algorithm, because of course that's possible. None of this is hard and fast, so you do need to be careful, but start learning how to recognize those things. And if you use these algorithms, then it might make it a lot easier to come up with the diagnosis. So I'll leave you with my Pacific Northwest Pride slide. This is the Painted Hills in Central Oregon that was created by a lot of volcanic activity and strata over thousands of years. They're amazing and they're incredibly friable. Thank goodness it's a desert or they wouldn't be there, to the point where you're not even allowed to walk on them. You're only allowed to walk around them and take a look at them, but they're a beautiful sight to see, unlike anything I've ever seen before. And this picture doesn't do it justice. It's a very vibrant maroon color within these hills when you're actually there and present. Thanks for listening, and let me know if you have questions.